Hello country girls, my name is Rebecca. I am a GP registrar in the West Midlands and I am interrupting your Instagram today to tell you all about cervical cancer screening. I know it's a bit odd, we're a shooting group, why is some doctor coming on here and nagging me, telling me to get my smear? It's because it's Cervical Cancer Screening Awareness Week. I'm really happy that the team at Country Girls have asked me to come on their Instagram to tell you all about it, and I've also written a blog for the website as well. So cervical cancer screening, probably not the most fun thing that people want to talk about or listen to someone blether on about, but it's really, really important and I'm really passionate about it. And I know a lot of women feel uncomfortable and don't get it done because they're not too sure and, you know, they just feel uncomfortable with the process. So what is the process? It's basically you get a letter first off when you're 24 and a half. That'll invite you to have your smear at your GP practice. You'll then get it every 3 years up until the age of 49. You should just automatically get a letter. From 50 to 64, it's every 5 years. Over the age of 65, there are some reasons why women get them done. It's mainly the fact that they have had a recent abnormal result or they haven't had anything since they're 50. Also, if you're pregnant, you can still have things done. So if you find out you're pregnant and you're due your smear, it will get delayed to about 3 months after you deliver. If you've had it done, you have an abnormal result, and then you find out you're pregnant, don't worry, you should still go through the next steps and it's important that you do. So what are the next steps? So with the smear, the common misconception is that it can actually diagnose cancer. In itself, it doesn't diagnose cancer. It basically looks to see if there are any abnormal cells or presence of this virus called HPV, which I'll talk about in a little bit. From there, if you do have abnormal cells, you'll get contacted and you'll have to go to the hospital for a camera test and probably a biopsy. That will diagnose you with cancer. So if you have an abnormal result, don't panic. You just need further testing before we can say definitely what's going on. So HPV that I mentioned, I'm sure everyone's fed up of hearing about viruses and vaccines, but HPV is a human papilloma virus. There is a cervical cancer vaccine and it's basically for this virus. It was found to cause a majority of cervical cancers. So the vaccine was introduced into teenage girls to hopefully try and prevent this, because unfortunately you don't know if you've got it or not. There are things which put you more at risk. So if you have multiple sexual partners, if you have unprotected intercourse, or if you have a sexual partner who has HPV, then obviously that puts you at risk of getting it yourself. So also just a call out for safe sex as well, and barrier protection. Sorry if that's annoying, that's the air ambulance just flying off now. So with the smear, it has changed slightly. Before they didn't really look for HPV. Now on the test, they look for the presence of HPV. If there is it there, then they'll look to see if there's any abnormal cells. If there are abnormal cells, and I said, then you'll go for your camera test. So when you get the abnormal result, you should get a telephone call. If it is normal, then it's a really good test. So it's pretty reassuring that things are normal. So you've got your letter, you've called up, you've got yourself booked in. What happens then? More than likely it will be with a practice nurse. Some doctors do cervical cancer screening clinics, but mainly it's a practice nurse. So they're very, very used to it and they're very, very good. You go in the room, we start doing our spiel about what it is, why we do it, and consent you for it. I love the medical profession, but we do this every day. So we do just kind of start chatting at you and telling you all about it. Do feel like you can speak up. It is an intimate examination and not all women feel comfortable with it. There are things we can do, you know, we can try and make you feel more comfortable. And my most important thing that I want to say is, and I say this with any intimate examination to any of my patients, your consent for the examination can be withdrawn at any time. If, you know, they're halfway through and you don't want to go through with it, just say and they should stop. Okay, that's a really important point, and hopefully should make you feel a bit uncomfortable, not feel like, oh god, it started now, I've just got to go through with it. Obviously I'm always going to encourage you to get the smear and to persist through, because it's really, really important, but I do caveat that with I'm fully aware it's an intimate examination that some women just aren't comfortable with. So do make sure you're feeling safe and you're feeling that you're able to go through with it. It shouldn't be painful. I'm not going to pretend it's the most comfortable thing in the world, but you shouldn't be in pain. If you are, then, you know, speak up and they should stop, or, you know, change things. With that, once the smear is done, and they've, you know, it gets done via a speculum, which is a little plastic thing that looks like a duck's beak. It doesn't last long, it's over in a couple of minutes. And then, as I said, the stuff will get sent off to the lab, and then you should get contacted through your practice about the results. So that's basically what happens when you go for a smear. There are some symptoms to look out for. As I said, cervical cancer screening, the smear, isn't a diagnosis tool for cancer. If you do have any of these symptoms, it's important that you don't either wait for your next smear or that you try and book a smear earlier. Unfortunately, it's 3 years apart. You can't do it any earlier. If you have these symptoms or you have any concerns, then just call up and book an appointment with your GP. I know we're super busy. I know the lines are really full at the moment, but do persist. It is really important. If you have any bleeding between your periods, bleeding after intercourse, if you have any discharge that's just a little bit blood stained, or if you have pain that's kind of really low down in your tummy, or particularly during intercourse, then just pick up the phone. There are other things that can be and that can cause that are a bit more common, but it's just really important that you call up. And then don't be surprised if we don't do a smear. We'll probably examine you and just have a different process for things. That's because you've kind of gone beyond the screening and it's looking at symptoms. So that's it really. I think that's everything I wanted to talk about. If you have any further questions, then have a little look on the NHS websites. There's loads of information out there. Just make sure it's from a good source. And tell everybody you know. Tell all the women in your life and everyone you know that's got a cervix about it. I'm always harping on it, my friends and family, about various health things and screening things. So I'm hoping that I've made you feel happy about it, and feel more confident in calling up and booking. It should all happen automatically, but if you're not sure where you're at, because let's face it, time has passed in a very bizarre way in the past year, then you can call up and your receptionist should tell you if you're due or not. And, you know, I know we're still in the hopefully back end of the pandemic, but you should still, we've always been doing smears, we've always been open. So just call up and get them booked. So that's everything from me. I feel a bit odd saying happy cervical cancer screening week, but happy cervical cancer screening week.